Hey everyone, welcome to Vet Visit. I'm Dr. Hansika Singh and I'm a veterinarian. So, if you're a veterinary student or if you aspire to be one, then this video is going to be a reality check in terms of what and how much will be taught to you during your BVSC and AH. I feel that it's important to address these points because if you really want to learn and know more, then you can start putting your efforts in advance during your college itself in the following spheres. So, number one on the list, species. In BVAC and AH, we are mostly taught about species like cattle, buffalo, poultry, sheep, goat, as they serve the economy, and other species like cats and dogs, as many people have them as pets at their homes. But when it comes to exotic and some other species like parakeets, rabbits, tortoise, and the like, we are not taught about them as extensively as we are taught about other species, as I mentioned. So, my advice to you would be that try to know about the common diseases, drugs, and the treatment for these species as well in your college itself, so that in future, whenever you handle a case of these not so common species as pets, then you should be able to handle these cases confidently. Number two, surgery and diagnostic techniques. So during BBSC and AH, your hands-on experience in surgery may remain limited as the surgery would mostly be performed by PG student or professor. So the truth is that immediately after passing out, you may not be able to perform independent surgeries. But having said that, it does not mean that you cannot make most out of your surgical and diagnostic experience during your BVSC itself. So some of the commonly performed surgeries are spay neuter, oral hematoma, tumor resection, cystotomy, and also there are a lot of dogs and cats who reside in and around a college or hostel. If you happen to find a surgical case in them, then good. If not, then you can try catching those dogs and cats and request your senior to teach you spay neuter surgeries or diagnostic techniques like ultrasonography on them. So, by this way, you will not only learn the surgeries but also you will learn most about the post operative care as well. Number three, latest commercially available drugs and tactful owner dealing. So, the owner dealing is actually quite different in an academic setup as compared to a private clinical setup. Also, many students are not aware about the latest commercially available drugs. For example, against tick prevention, a private clinic may be using drugs like Fluralana, which is sold under the name tablet Brevecto, whereas in college, only ivermectin injections are being prescribed. So, leaving the students unaware about the commercially available drugs and also other preventive measures about the ticks. So, my advice to you would be that try visiting a private clinic or hospital during your BVSC as much as you can. You may not be able to involve practically in a case, but just by your keen observation, I'm sure that you can learn a lot. So, this is especially useful for those students who look forward in setting up their career ahead in clinical practice. So, number three, about placements. Actually, a few of you asked me on my previous videos whether the college provides placements or not. So, no, there are no on campus placements in colleges. You will have to search for the jobs on your own. So yes, that's it for this video. If you like this video, then please give it a thumbs up. Do share it with your friends. If you haven't subscribed to Vet Visit, then yes, please do. Do hit the bell icon so that you're always notified whenever a new video comes up. Also, do follow the Instagram and Facebook page of Vet Visit as well. I'll see you next time. Till then, take care of yourselves and keep loving animals like you always do.